Okay, it's 7 o'clock. I'll call the meeting to order. Attendance, I'll take attendance. Who's here? Laurel Gorbo,
Aye.
Candace Linehan, Elaine Silva, Ruth Clay, and Cindy Longo. Am I correct?
Correct, Mundo.
Okay. Is there anybody from the public on that is going to speak? I will open up public participation. There's no member of the press either. I believe they're at the end.
Yeah, Mike Karaji's on.
Okay. That is correct. There is no one who wishes to speak. Okay, we'll close public participation. First on the agenda tonight is to approval of the minutes from the meeting of February 18th. Any comments?
I make a movement to approve the.
Second.
Second, all in favor?
Aye.
Has to be a roll call.
Gorville,
Laurel?
aye.
Laurel?
Linehan, aye.
Aye, Silver eye. So moved. Next on the agenda is the approval of the minutes from, am I correct, in February 16th?
No, February 11th.
I'm sorry, February 11th. There it is.
I'll move to approve those minutes as written.
Thank you. Second,
Gorville, second.
roll call,
Linehan, aye.
Gorville, aye.
Silver eye. So moved. Acceptance of the minutes. Next on the agenda will be Ruth Clay, Health Director's report.
So I actually did send a report. Something I know haven't done in a while. So I don't know. I gave you some latest stats on cases. I gave you a, pending. We're not done. Our last big clinic is Friday, but I gave you how many we've done to date, and I think we have 414 for Friday. We're doing 10 homebound tomorrow, and Harts Hill on the 25th. We really don't have that many homebound, so but we just got a new list today, of course. But we actually only had, tomorrow, but we'll go through this new list and see if there's anybody else. Plus, we'll be doing 40 people at Harts Hill, and then obviously the second doses, but that's it. And let's see, what else? COVID. Numbers are going up. They're continuing to go up. They're going up all over Massachusetts. We're one of the, I was just watching the national news, and Massachusetts is one of, I don't know, was it 10 or 17 states with at least a 10% increase in cases. So it's not just Wakefield, it's everywhere. I know, the other health directors in our coalition that I talked to, everybody's lamenting that the numbers are going up.
Do you think it's more testing, Ruth? Do you think people are testing, or do you think it's more household? I know that.
More households. I know you had asked for information on clusters.
Yeah.
We really basically have one cluster going on right now at a business. We've had at least one other business cluster. This is Liberty, Mazda, and they do two things, Mazda and
Chevy.
Sure.
Yes. So, and that's actually not just the Wakefield location. They have other locations, and their people go to more than one dealership. So that's a cluster that's being coordinated because of people all over the place. The rest of them are adults who are socializing and giving it to each other and then giving it to their kids.
Yeah, I was just
So-
talking to a colleague who's at the hospital, and the numbers are not really, they're kind of staying there and, still shifting people to the ICU, which I just think we need to remind people, because, people still get enormously sick with this. We still have a death rate.
Well, hopefully that part will come down significantly, because
With vaccinations and
Yeah.
with the vaccination,
Mhm.
really, people over 75 for the most part are vaccinated. And so that, they're the group who are at highest risk for mortality. So deaths really should start coming down soon, and also hopefully hospitalizations.
Mhm.
So the governor announced today
Yep.
the schedule of vaccinations for everybody. It's the same schedule that he came out with in December, but he's just saying, yes, this is the schedule, but that doesn't mean it's vaccine, just means you're eligible. And when there's vaccine available, you will be able to get vaccinated. We have a lot of phone calls for people that say, but I'm eligible.
Mhm.
And we
Yeah.
say, yes, you are eligible, but I don't have vaccine to give you.
Mhm.
So, however, more vaccine is coming into the state. And in the beginning of April, we're supposed to get a dramatic increase in vaccine. So the new registration system seems to be actually working well, where you just pre-register and then they get back to you as they're filling appointments.
Yep.
And they have
Mhm.
started
Yep.
filling appointments.
Yep.
Good.
So if people pre-register,
Yep.
that's really easy. You just pre-register and then you don't have to think about it until somebody gets in touch with you saying, okay, we have an appointment for you. So hopefully the new system, which is called Color, hopefully this new system will make it a lot easy for everybody.
Is it an offshoot of Prep Mod, or is it a completely different?
Completely different system.
Interesting. Okay.
Completely different.
So we're still using Prep Mod to
We're
do
using
data?
it for these last few clinics because it's a good way for us to collect data.
Right.
Who is it first or seconds, the
Yeah.
ages, things like that. So even homebound, we're putting into Prep Mod as a group, just so it's easiest for us to keep track of inventory and everything.
So is anybody else using Prep Mod anymore?
No, Prep Mod is being phased out,
Right. So
and so are local health.
right.
So, local health, at this point, this week, maybe next week, are probably the last public second dose clinics.
Yeah.
Wakefield, Stoneham is this week, Winchester is next week. So, that it's just not going to be local clinics. And the regional clinics and the state clinics do not use Prep Mod. And the pharmacies have their own system and the hospitals have their own system. So.
Wow. So you have to wonder how the epidemiology is gonna be.
Well, it
hopefully.
all has to be reported into the MIIS.
Okay.
So
Right.
that's how they keep track.
And the MIIS now is going to be, did you, on Maven Tuesday, mention to us that now they are going to be able to take the vaccine records from MMIS and link them into the Maven accounts so that
Oh.
we will probably know about those. And
Interesting. That's great.
Yeah. And then the thing with it too is on Maven, I don't know if you noticed it with the vaccine, you only can put in one. So if you've had somebody who's had 2 vaccines, you can't put in 2, but you can kind of indicate it in your notes, and we don't have to have the lot number. Because that was
God.
very difficult getting lot numbers from people. They knew what vaccine they got and when, but they couldn't tell you a lot number. They had to go look for their records. So,
Right.
so
That's
they're going to be able to
usually
do that.
important.
That and the variants are now going to be shift over a little bit. So we'll be able to know them on Maven when we go into a case. It's going to be a little bit different. They're upgrading. I don't know how long it'll take them and if it'll work, because Maven.
That doesn't change the clinical or the
No.
epidemiology as far as case management and
Yeah.
contact tracing. It's really an
Yeah.
academic issue, so.
Well, it's interesting. And I'm wondering how it's going in Massachusetts because New Hampshire put out a very specific residential and day camp guideline. I have to say, I was pretty impressed with it. And it
Well,
includes,
Massachusetts has come out with that overnight camps will be allowed this year. They were not allowed last summer. And I think they're about to come out with, I mean, there are camp regulations already in place, so.
yeah, I mean, it's interesting. There's a day one, there's a pre-camp testing, a quarantine period, day one testing and day 5 testing. And I'm responsible for managing those contracts. So it's been very interesting just to kind of look at the business end and who is popping up to do this stuff.
Interesting.
Yeah, it's been,
I haven't heard any of that from Massachusetts yet, so.
yeah.
The only thing they've said is that they will be allowing overnight camps. Because this is when people register.
Yeah, no, I mean, I have to tell you, I was very impressed with the caliber of webinars coming out of the American Camp Association and the American Camp Nurses Association. That was a lot of stuff going on last week. Really high caliber. So I learned a lot.
I think they want to be really careful too with the camps.
Oh,
It's
yeah.
very important. There's going to be so many children probably going to camp, although I see now that they're also recommending possibly summer schools to help some students catch up on what they missed. So it'll be interesting to see if more will go to a camp. I hope so. I think they need it. Camp is good. Anything else, Ruth?
I don't know if there are any questions about anything I put in there.
No, so we have Clinic Friday.
Yeah.
I just need to shoot out a revised list for the nurses because there's been that, a couple of additions to the risk list or the screening checklist.
So we have the revised, it's already done and laminated. No, I don't think we ended up laminating them. And they're on green sheets instead of yellow, so.
Oh, so we know they're different.
So you won't, there's no way to mix up whether you're using the
Okay.
old screening questions and the new screening questions. It's all done, it's all set.
Okay, what time do you want people there? I thought,
I believe 8, because we start at 9.
9.
so I'll be there 7:30 to pull first doses out.
Okay, and I'm bringing the vaccine over tomorrow.
Okay.
Did you
I'm
want me
getting
there
it from the
earlier?
I think it's fine. So I just calculated that were you going to use between 59 and 69 vials of Pfizer? We're using Pfizer, right?
We last week, let you know, Laura, we were very surprised in Melrose. We were getting 7 doses of vial. Unbelievable.
Oh, okay.
Best I've ever seen. The air. I did them all myself while I was there, and that air right up was the best batch I ever saw.
So
I was so
satisfying.
excited. I was so excited. I said, everybody, watch this air come up.
Yeah, no,
So
I
So
found
what
that as
Karen and
well.
I did today is if you got 6 doses of vial, you would need 70 vials. There will be 71 vials just in case one
Yep.
vial pops.
Yep.
So you should,
You're right.
should be pretty much right on.
Okay.
Sounds good. Sounds great.
Well, we're experts now.
Yeah. Now,
Now that it's over.
All right.
well,
so-
you never
The
know. You never know.
Housing authorities and all, we have the Moderna for that.
Okay.
There
okay.
are some communities who have gotten some J&J, but we're not getting any no more anyway, so it doesn't matter.
Do you think anyone's going to change their mind on that?
What do you mean?
The state? Do you think they'll switch back and say, it doesn't have to all go to the megas and give it back to communities? You don't think so? Okay. That's too bad.
The governor was asked on TV if he felt that he maybe should have went with the original emergency dispensing and stuff like that from 2001 with local boards of health. And he said,
Yeah.
no, he thinks that he made the right decision.
I mean, I have to say, it's
It's taxing.
you
It
guys
is.
are exhausted, and if our job is also case management and follow up. I mean, that
Mm.
already, I mean, I was happy to do it, but I don't, but it was tough to watch you. It
It's
was
even
hard
better
work.
now. It's easier now, Laura. When you call, there's 4 or 5 in the house, so you just go up and down. You're
Well,
there.
everyone, I
Yeah,
know.
but I think it was the compliment on from so many people, and in talking and so many other people from public health saying, Ruth, what a fantastic job you had done in organizing the communities and the setup of both places in Melrose and Wakefield. And I feel bad for the residents. They so much appreciated it. They really, really appreciated everything we did.
Yeah.
I think thank you, Elaine. I think the value added when we do it is it's much more personal.
Mhm.
People get to actually see each other, which is definitely helping people's behavioral issues and socialization issues. Having our local EMTs, they're not just standing there watching, they're interacting,
Mhm.
they're chatting, making connections. So I do think that the value added on our clinics, which it's not measurable, but it's much more personal and personable and a much more friendly and positive experience. It's not, but
Well, I think
when you
on
need
our,
to do everybody, you need to do everybody.
right, and on our part, and I said this, after H1N1 and where we were deputizing pharmacies, the kind of cool thing about an annual flu clinic, for instance, is you had eyes on your community, and you could do kind of a quick assessment,
Yeah.
from year to year. So there were people who knew who the public health nurse was,
Oh, absolutely.
and so I think that piece is somewhat measurable. But we did fine work. Do we have any sense of or is there an ability at some point to pull from MIIS a zip code and kind of figure out how much of our population is vaccinated at any point?
Yeah, actually, it's on the state website. They
Oh.
posted it last Thursday night. So that's been an ask we've had for a while. And on the state website, starting last Thursday night, is vaccination information by zip code.
Oh, good.
So, yep,
That's super important.
there, which I think is a really good thing and very helpful.
Okay.
I believe I mentioned in the health director's report the grant that we are writing. Yes, okay, so that actually, there's a meeting about it tomorrow evening that I'll be on. We're planning on applying as our 6th community coalition, the Mystic Valley Public Health Coalition. It's a $300,000 grant for 3 years. And our intent at this point, unless there's some dramatic change, is that the purpose, what we're looking to do is Melrose and Wakefield, we already have a formal district that's recognized by the state. What we want is to not necessarily formalize under the state law as a district, but formalize the coalition into a form that the state recognizes as a district,
Right.
not with a capital D. And it can be MOU like we have Melrose and Wakefield. We just want to formalize the arrangement because we've been getting a lot more resources than the other communities because we're part of a district. And we have been operating as a district for many years. And the past year's pandemic has really underlined our work as a district, not only professionally as we've shared resources and done regional clinics, but also actually on a more personal level with the health directors being very supportive of each other personally. We've all had our low points, but as we've been saying, as long as we don't all have a low point on the same day, then we're okay. We've spent a lot of time in evenings and weekends talking through things with each other and basically talking people off the ledge. And that's been just as important as the other part. So it's been a really big behavioral health positive for us. So anyway, so it's for that also to look at all the different things that we're doing to see are there other shared services, formalize some of the informal shared services we do already. For example, Man-2 tests, Stoneham does for us.
Oh, I didn't know that.
Lead determinations, Malden does for us. New kids coming into school that need vaccinating, Malden does because they have a standing clinic. We don't have the volume.
Right,
Again,
to
they're
get the
multi-dose
vaccine.
vials. We just don't have the volume to keep that inventory. So there's a lot of things that we've already been doing for many years that we'd like to, more formally identify, look at other opportunities. And then we are looking for 3 full-time additional people. One would be the coalition coordinator. It would be that person's job to do the work to the administrative work necessary to formalize the arrangement. They'd have to go to the quarterly meetings and go to the meetings, do the reports, things like that. But also we're looking to hire a full-time food inspector, not really for Wakefield because we're actually on top of things, but Stoneham, Medford, and Malden really need additional resources. They need more than one, but at least one shared among would be helpful. So it's a food inspector. And then again, not necessarily for Wakefield because we have a communications director, but hiring a full-time communications coordinator for the district. We do have a website. It needs to be revamped, updated, maintained, expanded. We really want to have much more of a social media presence. And we're going to call the position a communication/outreach communication person. So they also will have a specific task on working on communication with subpopulations, not different languages, but also other hard to reach populations. So not only raising our social media presence in the general community, but also very specifically with some of the hard to reach population. So we'll be putting money in for those 3 positions. We're also looking to put some money in for shared animal control nights and weekends coverage where, where Wakefield, it's not part of the health department. But for 3 of the 6 communities, it is part of the health department. And that's just been a long-standing bugaboo that we've just never really been able to get our hands on. So I'm really, really excited. The application is due April 1st. The grant starts May 1st. So it's not, it's going to be a pretty quick turnaround.
Yeah.
They're planning on granting 30 grants, but of course it depends on how many apply and how much money each applies for. They just want to get something. It's really, really very simple application. They just want something in so that they can start a conversation and push the money out starting May 1st. So that's great. This is really, really exciting and perfect timing for the group that has grown organically. So I'm really excited. I'm really, really, really hoping that we get it. And we're having, the intent at this point is to have Wakefield be the lead agency. To to be honest with you, we have the easiest accounting process here. And it's just, the logistics of the accounting can get to be really difficult. And Wakefield has an easy system to work with. The cities, are kind of a more difficult process. So at this point, it'll go in with Wakefield's as the lead program and fiscal manager. Doesn't mean that people have to be physically located in Wakefield, it's just a matter of the formality. Steve knows about it, and after tomorrow's meeting, I basically want to finish writing it this weekend and get it in and be done.
Amazing.
Good luck.
Yeah, good luck. Sounds awesome.
Yeah, great. It's a great one. Is there anything else? Anybody else have any other business? Anything come up? Any other business, Ruth? Come in
We
since the
did,
posting?
Oh,
Yeah.
just for the follow-up for the last meeting, and I put this in the report. I put the Sabatinos in the report, and I did talk to town council, Tom Mullen, town council, today, and we have given him the paperwork for the dumpster late fees. So he will do he'll do the paperwork to go to court with the gentleman who just refuses to pay that. I really, I could contact the dumpster company and say that they don't have a licensed dumpster and pull it, but that would just create another problem.
right.
So I don't really want to cause a trash issue. So Tom is working on that. And we also have a meeting set in April to really actually finally move forward on 383 Water Street. So that is bound and determined, but that is going to happen. So,
Oh, yeah.
and that will be with town council,
It's like
zoning,
chipping away at the address.
conservation,
Yeah.
health. And there's been a change of circumstances there where there's new neighbors
Yeah.
who are very active
Yeah.
in wanting to resolve this and providing some really good resources. So I'm actually also, I know I get excited about the oddest things, but I'm very excited about.
Not COVID.
I know. I'm just really excited about finally addressing
Addressing
this.
it. It's a sore
That's good.
spot.
That's really good. That's good, Ruth.
Well,
Anybody-
I would be excited if we could do something about litter.
Yeah, so we are, that was, okay, thank you, Laurel. The other thing I asked Tom Mullen to do is to talk to his counterpart in Chelsea.
Mhm.
Chelsea does have a ban on nips. They were sued. And so we're trying to find out what the status is of the lawsuit in, the longstanding public health tradition. One community does the outside the envelope regulation. They get sued, usually by Cumberland Farms. And then we wait and see how that goes through the courts. They lose, community wins, and then the rest of us move forward. So we're just trying to find out where they are in the court process for that. Because, if the courts hold up, allow that, although it wasn't a Board of Health regulation, I believe it was a city ordinance. That certainly paves the way for others.
So just to
And,
back up, yeah. So this came up at, so we had a wake up meeting yesterday. I have to say they've done an amazing job at staying active, and the youth council in the Yaddles, still can't, that name kind of cracks me up, but really great kids coming through the system, very impressive. We had a young woman yesterday who just gave a terrific presentation on a mental health survey her crowd had done amongst her peers that just either validated or altered a little bit the priority of the adults in the room. So it was pretty cool for school. But I also had walked across uh, at least 100 nips and other assorted debris on the side of Holland Road. So I took a picture of it on Facebook. I only had a small bag with me, so I got like 45, but it was similar to a picture we got in a lake cleanup where we had all of those little cartridges for Juul e-cigarettes.
The dual ones, right?
Yeah.
So it's still, those, and it was so interesting because I had mentioned, it's time to get rid of nips, and I kind of got a response going, "Oh, come on, you're overreacting just because some people litter from time to time. It's not everybody." And I'm like, I don't know. When you walk around town, that's where they go. And it was interesting because that person then went and researched the Chelsea rule and said, yeah, they're talking about decreased drunkenness, less litter, a few other things.
Every week we pick them up right in front of my house. I don't know if it's because we live like on a street where people walk past my house to go towards the playground where
Right.
possibly folks may gather to celebrate together or
Yeah.
what.
Yeah.
But it's crazy. Just along my front yard every week when I put the trash out, I have to scoop them up. It's like a fancy bottle or a can of beer, but usually it's nips.
Chief Scory at the Wake Up meeting just basically said that nips are used to pour into coffee and other drinks and drink and drive. And he feels very strongly that, it's a serious drink and drive issue. So, so anyway, we are following up on that to see where we're at, and also to do some work to reevaluate the liquor stores had come up with, I think it was 5 things that they had voluntarily agreed to do to, and we had checked them earlier, but we haven't checked them lately. So we're going to work on, I mean, that can't be something kids can do because you have to be 21 to enter the store, but we can, maybe some of the Wake Up volunteers on the coalition can do that. I mean, there's only 5 liquor stores, so it's not that big a deal. But anyway, we talked about doing that.
Well, and it goes hand in hand with, the fact that we know people are consuming more during COVID. So it's kind of let's do a little assessment.
Right. And I thought the big interesting takeaway from yesterday's Wake Up meeting is that for the first time this year, we have 2 graduating seniors who have been a Yaddle since 7th grade.
Yep.
Wow.
So they've been on the youth action team from 7th grade. So it's going to be, our end of the year meeting, I think, is going to be very special that way. I think that's pretty cool.
Yeah, that is cool.
That's
Yeah,
nice.
I can't believe we've been around that, that we've been doing Wake Up that long. And that's,
yeah, they were part of the first group.
Yeah.
So it's great. It's a great milestone. And the behavioral health grant that we were awarded, because Kara's going to be the staff person and she's already a Melrose employee, even though I wanted it to go in as a Wakefield grant, we decided to make it a Melrose grant because she's already a Melrose employee, and it made it easier payroll wise. So that has to be approved by the city council. It went to their meeting Monday night. It goes to appropriations tomorrow night. Appropriations is when, they ask me questions, assuming and hopefully they vote to approve it. It goes to the next city council meeting where it's approved, and then we can start using it. So,
do you ever in those meetings just sort of remind them that the 2 boards get along pretty well and we know how to work together?
Oh yeah.
Because every so often I feel like that gets lost. I mean, just that like it's working, we know what we're doing, but I think that people who don't know us might be like, getting the exact percentage that we agreed on,
Well, to be honest with you, Laurel, I haven't even been in front of this board since Mayor Broder took over. So
so we'll see.
this particular board, this will be the first time I'm even talking in front of them. They've been there a year and a half-ish.
Mhm.
So, but any other time that I've been in front of the board, it's usually for a grant,
Mhm.
and they're all been regional. And so historically, now of course there's only 2 on now that have been on in the past. There's always been a very strong dialogue about how everything we do, we do as a region.
Good.
Kind of a joke with them, like, okay, so of the communities, which ones are on this grant and which ones are on that grant? But we're really trying to even that out so everybody's on the same grant.
Yep. Just bring a
Okay.
Rubik's Cube.
Yeah.
Okay.
Sounds
Oh, we
good.
lost her. Okay.
So
Okay.
I think that's all we got.
Yeah.
All we have. That's a good thing, isn't it?
When's our next meeting?
Our next meeting would be the 3rd Wednesday of April, is April 21st. Maybe Candace knows, is that vacation week?
It is
Yes.
vacation
Is
week.
it? But are they having a vacation in April, or does anybody
no.
know?
My kids
No.
don't go to school. They're too little.
Oh, perfect. All right. It's not an issue for you.
Oh, good. That's all right. That sounds good to me.
None of us have school-age kids, so we're in that in-between stage. You're before school and we're all way after school. So it doesn't matter.
Candace,
Okay.
how old are they? Forgot.
The big one's 5 and the little one is 3.
So next year. Okay.
So yeah, Taylor's registered at Woodville for the fall.
Yay.
Woohoo!
One failed there.
We'll see what it means.
Excellent.
Sounds like fun.
Yeah. Yep. I'm
All
excited.
right.
PTO,
So,
baby.
The
Yeah.
21st is cool.
Okay.
So if we can have a motion to adjourn, and our next meeting will be on Wednesday, April 21st, 2021. When is the election?
Oh, right after that.
Right
27th.
after that.
27th.
the
Oh,
20
that.
We're wishing you luck,
Thank you.
Laurel. No one
And
opposed
town
you this
meeting
year.
is May 8th.
Yeah.
Same rules for COVID for May as they were in November.
Oh, okay.
And June. No?
No, it's May 8th.
No.
Yeah,
But
it's still
last
May.
year we moved the May town meeting like into the summer, and
Yeah.
that's when we
No, I
changed.
know, but
Yeah.
June was when they put out, I mean, not June, November,
Right.
they had town meeting regulations for fall town meeting.
Okay.
So it's the same, and I sent them to, Betsy and Steve and Tom Mullen, I think. I sent, just said, they're the same, but here they are. So.
Okay.
All right. So if we can have a motion to adjourn.
Take a motion to adjourn.
I
Okay,
second
can I
that.
have a second?
Goreville seconds.
Okay, all in favor?
Linehan, aye.
Goreville, aye.
And Silver Eye, so moved. So we call this meeting at 7:38 PM.
Well done, team.
Happy
Okay.
St. Patrick's Day.
Happy St. Patrick's Day.